Hi everybody, my name is Mitchell Farmer and this is MSK Lab 6 covering the shoulder region part 2. I'm going to start us off with the deltoid muscle. So the deltoid muscle actually is three muscles that kind of combine to a similar distal insertion, but they have variable posterior insertions. So there's a posterior part, a middle part, and an anterior part to the deltoid. The posterior part of the deltoid attaches to the inferior edge of the scapular spine, which if you recall is this area of the scapula I showed you earlier in the lab. The middle part attaches to the lateral side of the acromion process, which if you recall, the acromion process with the clavicle makes the acromioclavicular joint. And then the anterior part attaches to the lateral 1/3 of the clavicle, anterior to the trapezius muscle. However, though they have variable proximal insertions, as I previously stated, they all have a similar distal insertion, which is the deltoid tuberosity of the humerus, which I showed you earlier in lab when we were covering osteology. Now, since there's three parts, the action of the deltoid is somewhat variable. The anterior and posterior deltoid assist in flexion and extension of the arm, respectively, whereas the middle deltoid is a major abductor of the arm beyond 15 degrees to about 120 degrees. So I'll just show you that really quickly here, and then I'll talk a little bit more about the deltoid. So this is arm abduction. And the important thing with arm abduction involving the deltoid is that when the arm is sitting directly to the side of the body, there's no lever for the deltoid to pull the arm up, because the angle of which the deltoid is inserted on the arm. So instead, the first 15 degrees of abduction of the arm, let's exit out of that mode and exit out of this, the first 15 degrees is largely done by the supraspinatus muscle. And then after that, both the supraspinatus and the deltoid begin aiding in abduction. But since the deltoid is so much larger than the supraspinatus, the deltoid does most of the work. So just recall that first 15 degrees, and that'll be important when you're like looking at rotator cuff tears, because if they have a full tear of their supraspinatus muscle, they won't be able to move their arm through that first 15 degrees of the arc. Now, the nerve supply of the deltoid muscle is the axillary nerve, which is from the C5 to C6 spinal roots. And it is one of the terminal branches of the posterior cord of the brachial plexus, along with the radial nerve. Now, I'll be talking a lot more about the axillary nerve when we do cover the brachial plexus in full, but you can see it here on the models right. And one of the reasons the axillary nerve is important is because along with the posterior, highlighted here, and anterior, highlighted here, circumflex humeral arteries, which branch off the third part of the axillary artery, all three of those listed structures are susceptible to damage if there is damage at the surgical neck of the humerus. So recall the surgical neck of the humerus. I'll actually show you it really quick. Posterior view. Recall this is the surgical neck of the humerus, and that is distal to the anatomical neck of the humerus. And so if you have damage there, you could see how that would also damage the circumflex humeral arteries and potentially the axillary artery. And damage could be in the form of a break, but it could also be in the form of, say, a shoulder dislocation. So that's everything for the deltoid. The next thing I want to move on to is the quadrangular space. The important thing about the quadrangular space is that it contains the circumflex humeral artery and the axillary artery, highlighted here and here. I'm going to get rid of the axillary artery because it's a bit in the way of me explaining it. So, the quadrangular space, as you might guess, is kind of a squarish shape. Basically, you have the superior aspect of it is the inferior border of teres minor. The medial aspect of it, or the medial boundary of it, is the lateral border of the triceps brachii long heads. The inferior boundary is the teres major superior border, and then the lateral boundary is the medial border of the humerus. And so you could see that that would make this space right here. And one of the things that travels, or the two important things that travel through that space, is the posterior circumflex humeral right here, and then the axillary artery, which I already removed. Now, Just beside that space, or anatomically close to that space, is something known as the triangular space, which has three boundaries. Basically, you have superiorly, you have the inferior margin of teres minor. So this is teres minor here. Inferiorly, you have the superior margin of teres major. So teres major here, teres minor here. And then laterally, you have the long head of the triceps tendon, thus forming this triangle right here. And I'll just highlight the structures for you here. Here's the triceps brachii long head, short head. Here's teres minor, and here's teres major. And those are going to form the similar boundaries of the quadrangular space and then the triangular space here. Now, the important thing about the triangular space is that deep to it, I'm just going to zoom in a bit here, deep to it is something known as the circumflex scapular artery, highlighted right here. So the circumflex scapular artery, if I rotate anteriorly, you can see that it's still highlighted right there, and it travels posteriorly, and that's how it enters the posterior areas through that triangular space, deep to it at least. And it's the larger of two terminal branches of the subscapular artery. So the subscapular artery, highlighted here, is a branch of the axillary artery, and it has two terminal branches. It has the thoracodorsal artery, and then the larger, the circumflex scapular artery, which passes deep to the triangular space. Now the circumflex scapular artery, then as it travels through the space, enters the infraspinous fossa. So recall the infraspinous fossa is the area of the scapula inferior to the scapular spine, which I'm drawing my cursor over right now. So this is the infraspinous fossa. So circumflex scapular travels there, and anastomosis with the subscapular artery, as well as with the dorsal scapular artery, which in the cadaveric dissection you'll see sends branches into the infraspinous fossa as well. But that's not shown well in the anatomical model. But basically, the conjoining of those three arteries, suprascapular, dorsal scapular, and circumflex, form what's known as the scapular anastomosis, which kind of provides blood to all of those, variety of scapular muscles, the rotator cuff muscles. They kind of just draw blood as they're growing in children and in utero. So that's basically a quick overview of the scapular anastomoses. The next thing I want to talk about is the rotator cuff. So I'm going to pull up my model for the rotator cuff here. All right. So the rotator cuff is four muscles. There is the supraspinatus muscle, which lies in the supraspinous fossa. Similar to what I've been doing in MSK so far, I'm going to talk about proximal insertion, distal insertions, nerve supply, and the action they perform. So the proximal insertion of the supraspinatus muscle is the supraspinous fossa of the scapula. Its distal insertion, so it travels between the acromion. Recall that the acromion is the lateral extension of the scapular spine. So it travels between the acromion and the humeral head. So in this tiny space right here, you can see the muscle right here, and I'll hide this bursa. See the muscle right here. To insert on the superior aspect of the greater tubercle of the humerus. And a really important note about the supraspinatus muscle is this is the muscle most commonly ruptured in the rotator cuff. Now, as previously stated, it aids in abduction at the shoulder joint for the first 15 degrees before the deltoid takes over to do from 15 to 120 degrees. Its nerve supply is the suprascapular nerve. So supraspinatus muscle, suprascapular nerve. Now, the infraspinatus muscle originates, or its proximal insertion is the infraspinous fossa, and its distal insertion is the posterior aspect of the greater tubercle of the humerus. So this whole thing right here is the greater tubercle, and you have the supraspinatus superiorly, and then on the posterior surface is the infraspinatus. It aids in lateral or external rotation of the arm at the shoulder joint. So I will show you that, and I will actually also show you abduction of the arm once more here, just to reiterate that point. So we actually can't see the supraspinatus here, unfortunately, because I can't get rid of the trapezius, but you can see the deltoid working, and then the supraspinatus would attach right about here as well. If I X out of that, and I can come to the infraspinatus and show you lateral or external rotation. So this is lateral rotation of the arm. And you can see it here is the infraspinatus, and it contracts and draws that arm laterally or externally, whatever you want to call it. And its nerve supply is also the suprascapular nerve, same as the supraspinatus muscle. So those are the first two muscles of the rotator cuff. The next one, the next one is teres minor. Teres minor, I'm just going to get rid of infraspinatus. I'm also going to get rid of latissimus dorsi, just so we can see a bit better here, as well as the axillary nerve. So teres minor originates from the axillary border of the scapula and inserts onto the posterior aspect of the greater tubercle of the humerus. Similar to infraspinatus, it is a lateral rotator, so super easy. And its nerve supply is the axillary nerve, which isn't surprising because the axillary nerve exits via the quadrangular space, which is right by teres minor. And then the final muscle of the rotator cuff I wanted to talk about is the subscapularis muscle. But yep, is the subscapularis muscle. And I'm going to have to get rid of a few things to show that to you because, as you might guess, it is on the anterior surface of the scapula. So I'm just going to get rid of a few ribs here. Alright, so here's the subscapularis muscle, and we are having an anterior view, and highlighted here is the scapula with the coracoid process and acromion process. And here's the subscapularis muscle. And the area on the anterior surface of the scapula is known as the subscapular fossa, and the subscapularis muscle inserts onto the lesser tubercle of the humerus. So recall the greater tubercle, lesser tubercle. It's supplied by the upper and lower subscapular nerves, and its action is to internally rotate the arm at the shoulder joint, which I can show you, also known as a medial rotation. So this is better seen from this view. You can see that's external rotation and internal rotation, or also known as medial rotation and lateral rotation. X out of there, and then the last, so just to reiterate, the muscles of the rotator cuff are the subscapularis, highlighted here, teres minor, which I have highlighted here, the supraspinatus, and then the infraspinatus, which I've removed. Those are the four rotator cuff muscles. The last one I wanted to talk about, which is not a rotator cuff muscle, is teres major. So teres major, its proximal insertion is the elongate area at the inferior angle of the scapula, and its distal insertion is the lateral lip of the intertubercular sulcus. So recall the intertubercular sulcus is the area existing between the greater and lesser tubercles, and you can see it inserting right along there. It aids in medial rotation, adduction, and extension of the arm. So I've shown you all of those movements, but you can check them out yourself if you'd like. And it's innervated by the posterior circumflex, highlighted here, which is one of the things I said could be damaged if there's damage to the surgical neck of the humerus. That's its arterial supply, and it's innervated by the lower subscapular nerve. Alright, so that's kind of a whirlwind look at the rotator cuff muscles. I'll be talking a bit more about this area in the next couple labs. So hopefully that won't be too fast for you then. Thanks, and I will see you for next lab.